morning. We'll give this a whirl. I think there's going to be too much bouncing with the holder, but I want to get this video out regardless. Kate's Jen Shepherd from the Shepherd Center for Integrative Health. A rainy day here in the Cleveland area. What's important to talk about is history of heart attacks and the relationship and what happens to the tissues of the heart and surrounding the heart after a heart attack, and what this can mean for a patient down the road. So a brand new patient came in last week and concerning complaints of she woke up with neck pain, which many of our patients do. Wake up with some stiffness, and then that pain continued to go down the neck, actually over to the other shoulder, and then what concerned her is that the pain continued and was going down her back. So here is this kind of quote out of the blue, which we know nothing is ever out of the blue, but began on one side of the neck, and again, it's progressing, it's changing. So of course she goes to her doctor, she gets some muscle relaxers, it maybe helps some, but this pain is still progressing. So that is where she was referred over to say, hey, what else is going on? Are we looking at the right thing? Are we treating the right thing? And again, as we talk all the time, conventional medicine tends to put band-aids on things. There's pain, let's try to make the pain go away. Or especially in neck pain, back pain, the muscles are always the culprits. So they're addressing the muscles when in fact we know so often muscles are immediate light, so they'll talk, but often they are very, very rarely a primary, and there are deeper things or things elsewhere that are contributing to that. So again, getting to the root cause of things. So what was beautiful about this patient, again, this sweet woman came in, she's in her mid-60s, came in with pain, could barely walk, her son had to drive her in. And so we're going through all of history. So she does a full intake for me, of course. So I'm looking through her intake, her history of stuff, C-sections, lots of medications, lots of health illnesses throughout her lifetime. What my eye honed in on, because we're always trying to figure out why. Again, things don't happen out of the blue. So two hypotheses, or two big questions that I have for her when something comes out of the blue is, what'd you do the day before? What'd you do a couple of days before? Because often there is something that always triggers, right? The straw that breaks the camel's back. So for this woman, and her son was with her, again, they talked about a mad game of cornhole the day before. So, okay, a lot of cornhole, a lot of excitement, a lot of, unilateral arm throwing. So enough to set something off. However, there were things in place before that were ready. So in lieu of, was she chopping firewood, anything else, there really wasn't too much that created that vulnerability, that cornhole tipped over the edge. Until, as I skimmed through her history, this woman had a heart attack back in June, her second heart attack, and had a stent replaced. So we start diving into surgery, we start diving into how she had the stent went through the upper extremity, went through the artery down in the wrist, up to the brachial, into the subclavian, into the heart. So we talked about those mechanics again. We're just trying to understand why, right? Why is the body protecting? Why is it doing what it's doing? Why is it asking for help in the form of pain and progressing pain? So, so much of our work is driven by the listening, which is from John Pierre. Again, our trained hands can feel changes in fluid dynamics in areas that have not as good fluid dynamics for one reason or another. We're able to pursue those very quickly. So no surprise, I go in unbiased regardless of what I see in her history. Her body took me right to the heart and the pericardium, and so much tension, so much protectiveness throughout the tissues surrounding the heart itself. And as we look at a photo, a picture of the pericardium, it attaches to the front of the spine, all the way up to the neck into the sternum. So think about that, right? Here, one of the most, right, the two most important organs of the body, the heart and the brain. The heart went under significant attack, right? Or trouble and fear of demise. So, and then the surrounding procedures with it. So here, the body is brilliant, and it is protecting, right, one of these most delicate structures of your body. And in osteopathy, one of the primary tenets is artery reigns supreme. So again, if your vascularity system is compromised, your body will find whatever it needs to do to protect that main spinal system. Because if you're not getting blood flow to an area, or if the heart heart, through the tissues of the pericardium, and how they related to the neck and to the back as well. So as we started to free those tensions off, that absolutely took tension off the cervical spine. And the second session, we were able to go a little bit lower into the lumbar spine. The primary area was into the upper cervical spine area. So mechanically, absolutely. Does she have mechanical things? Yes, she has dowager's hump, flexed at T1. If she went through an X-ray and MRI, very, very likely, guaranteed, she's got some disc bulging, probably absolutely some arthritis. However, looking at her medical history, looking at the history of heart attack, she's had 2 heart attacks. It's those deeper illnesses, injuries, protective mechanisms of the heart that tend to drive, that I see in the clinic, that cause the outer, the musculoskeletal system to change. And as we know, when the musculoskeletal system, when joints aren't in the right position, or if joints don't have the ability to do what they need to do, strain patterns find another place. So the body will always find another place for movement. So absolutely, all of that would show up on her X-ray. However, was that the primary? Wasn't the primary? And even as you go into the pain management world, pain management doctors are trying to figure out, all right, what structure is the one that is painful? Is it the disc? Is it the facet? Is it the nerve root? I think in this woman's case, I think it was the fascia. As we know, the fascia has contractile properties. We're learning so much about fascia. So honestly, I think even if she went through all the pain management, which would be lots of time, money, and discomfort, would we really get to the answer? And still, it doesn't matter what's causing the pain. It does. It's important. However, it's the why, right? So all of that, what is causing the pain is the what. But we will never get there unless we get to the why. Again, her pain may go away, but still there is this deeper why that needs to be addressed. And if it's not being addressed, it's going to manifest in some other way because of the body's absolute brilliant protective strategies and adaptive strategies. So